Hello, welcome to this NMC OSCE tutoring video. My name's Hannah. I'm UK nurse, a university lecturer and an independent OSCE tutor as well, having been an NMC OSCE programme lead. And I am giving you a really important update that's come out by the NMC for January. And this is for adult and child OSCE students. And it's about the administration of insulin for subcut injections. And so they've released a new announcement that they are moving to the use of insulin pens instead of syringes. So I'm going to go through in this video kind of what that means, what an insulin pen looks like, how you use that correctly and administer the insulin correctly using the pen. So there's a new update. It's come in January. Okay, so for all those of you sitting your exam from now onwards, you need to be aware of this update. Okay, so if you go onto the NMC website and into the OSCE information, you'll see the updates, and they've announced a new update. Like I said, this is for child and adult OSCE candidates in relation to subcutaneous injection, and they're moving to insulin pens instead of insulin syringes. And this is a statement which is on the NMC website. So just in line with best practice, we are now moving from administering insulin via a syringe to using insulin pens in the children's OSCE. The insulin pens the test centres are using have been included in the equipment list. I'm going to show you a picture of that, but you can go to the equipment list on the NMC website and get that. And then from January 2025, insulin pens will also be used in the adult nursing OSCE. So what's an insulin pen? So insulin pen is like an injection device, and it allows you to deliver the preloaded insulin into your subcutaneous condition. So it's like kind of an all-in-one, got the insulin and the needle in it. They're really convenient and easy to use for people who are managing their own insulin. They can be less painful as well, and they reduce the errors. You know, they're easier to draw up the dose and get the correct dosage for people. So what do they look like? So they look a bit like this. So you've got the pen here. This plastic pen cap goes all over the end. You've got here in this white bit is what we call the insulin reservoir. So that is where the vial of insulin will sit, and you'll be able to see the name and the make of the insulin. You've got the dose window. So that's where you turn basically the dose dial on the end, and that will move the dose window, and that sets your dose of insulin. You've got the injection button where you will press that down to administer the insulin, and you've got an area on the end where you connect your clean needle each time. So on the NMC equipment list, this is the insulin pen which they have put on there for the test centres, and I'm going to go through setting this up and what you need to do. So this green section here, which has got this see-through windows, that is where the insulin vial will be. You'll be able to see the dose of the vial. This is the knob where you need to turn that to set your units here. So you can see the number of units here. And this green bit is where you press down that button to administer the insulin. Okay, so remember all the same principles still apply, even though we're just giving it through a different device. Okay, so remember the medications, you still need to do your key principles, your ID and your allergy checks. You still need to gain consent and explain the procedure. You still need to read and confirm. Okay, so remember, you'll still need to do the same procedure and the same principles. We're just giving the medication through a different device. So remember, you're still giving the medication, so you still need to do your complete ID and allergy checks. You still need to explain your procedure, get consent. You still need to read and confirm the validity of that prescription. You need to obviously get your equipment, and this time you're going to be getting your insulin pen, the needle that you will put onto your insulin pen, a sharps box, and some gauze as well. You still need to do your rotate your site, do your skin checks, and obviously verbalise and ensure the site is clean. And you should confirm the last blood glucose. So all those things remain the same from my previous subcut video. So first off, you'll need to check your insulin, and you'll need to verbalise that the insulin within your pen matches your prescription and that the expiry date. So exactly the same as you would do your vial, but instead it's going to be inside the pen. So on this pen here, you can see here it says no rapid pen fill here, so you know you've got your right insulin. Now, do advise just to gently roll the pen, because sometimes the insulin can become cloudy or sediment out in the pen. Don't shake it, but just roll it maybe 10 times gently between your fingers. Then obviously we don't need to wear PPE. We want to make sure our hands are clean before we administer. So make sure you decontaminate your hands. You'll have your needles, which will look like this if they're separate in the NMC exam, which they should be. You'll need to pull back the silver foil off the end of that needle cover, okay? So it will look a bit like this. So you just peel back that silver cover and then you'll screw that onto the end of your insulin pen. And then you'll take that white plastic cover off and you'll be left with the needle, which will have a second sheath on it, this sheath here. Okay, so that's how you change and load up your needle ready to administer your medication. Once you've done that, and make sure you're totally ready to administer before you take off that second cap. Okay, so make sure you've done all your skin checks, you've confirmed and rotated your site, that you've obviously read all your prescription, everything is done. So remember, once we take that cap off, we can't put that pen down and we can't resheath it as well. So make sure we've done everything before we remove that second cap. So pull it off, obviously mind your fingers, the needle will be quite small. And what we need to do before we administer is we need to prime the syringe and remove any air, okay? So how we do that is we turn the dial on the end just to 2 units on the insulin pen here, and you want to hold the pen up vertically, and then you're going to push the end of the pen and you just want to expel all the air, and you want to do that until you see a small bubble of insulin at the top. And that's really important because you need to remove the air and prime that syringe. Otherwise, you could technically be giving them not the correct dose, okay? Sometimes you need to do that a couple of times. So to 2 units, expel until you see a little bubble of insulin come out the top. So like this, so you just see that little bit of insulin. And again, you might need to set it for 2 units and do it a couple of times or just 1. So it's a really important part. Otherwise, you're not going to administer the correct dose of insulin. And that obviously would be a critical fail. Then you want to actually turn the dial to your prescribed dose. So on your drug chart, you'll have your prescribed dose of insulin, 10 units, 6 units, 12 units, 8 units. So you'll just turn that dial on the end here. Until this little window with the numbers on reaches your set amount, okay? And again, verbalizing all the time that you're setting the correct dose. When you administer the insulin, it's very similar. So you want to administer it at 90 degrees. Now, most places when talking about pens is you don't have to pinch the skin with the pen unless the patient is very, very thin, in which case you can. So you can just give it straight at 90 degrees, okay? So put the needle in 90 degrees, you're going to press down on the plunger and that's going to administer the insulin, immediately. And then you must wait and count your 10 seconds to make sure it is absorbing before you take it out. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then you're going to carefully unscrew that needle, okay, and put that directly into the sharp spin, okay? Remember, you can't recap that needle, and you don't want to put that pen down with that needle on because obviously there's a contamination risk there because it's been in the patient. So unscrew it, put it straight back into the sharp spin, put the big plastic cap back on the whole pen, and then verbalize for 10 minutes where it is kept. And then obviously after we've done that injection, we need to decontaminate our hands because we've been in contact with the patient. You need to document, on your prescription chart, you need to obviously sign date and time, and check the patient is comfortable and should check that they've got some food ready and available within the next 20 to 30 minutes. Hope that's helpful. Please share, because important update for lots of people. So share the video and share the update as well. And if you want further information, go to the NMC website, but they have just put that one statement out in a minute. Check the marking criteria, that remains the same. They haven't updated that to cover a specific insulin pen, but that might be coming out potentially. We'll just have to keep an eye on that. Again, available for tutoring, one-to-one OSCE tutoring. Feel free to email me on hannah.lames@outlook.com.